talk about periodontal disease and the effects on systemic health. Periodontal literally means around the teeth. And periodontal disease, it affects the gums, the periodontal ligament, bone, and the cementum that covers the roots. It occurs when dental plaque is not removed from the teeth. Bacteria lives in the dental plaque, and the symptoms can start being red and swollen gums, damage to the periodontal ligament, which holds the teeth to the bone, decreasing bone levels, which can lead to wiggly teeth. Periodontal disease is measured by a small ruler that is located on a dental tool and measures the pocket around the teeth in millimeters. Healthy teeth numbers are 1s, 2s, and 3s. Periodontal disease has probably occurred if you start getting measurements with 4 or higher. Healthy gums are firm and pink in color, similar to an orange peel, which is stippled and tight around the teeth. The first stage is gingivitis, which has reddening around the gingival margins of the teeth. And the symptoms you might start having when you have gingivitis is bleeding gums when you brush and floss and you go to spit into the sink. This part is reversible. Your pocket depths may still be within a healthy range, 1s, 2s, and 3s, but periodontal disease is the next stage, or periodontitis is the next stage. This is where the pocket depths become deeper, which then collect the plaque and the bacteria that's on the teeth. This pocket is below the gum line and cannot be cleaned at home. It needs to be removed at the dental office. This stage can be maintained. The final stage is periodontitis, advanced periodontitis. This is where the pocket depths have become so deep it has damaged the periodontal ligament and the bone levels have gone down. This cannot be reversed, and you may begin to lose teeth at this point. Your teeth may appear longer and may be sensitive to temperature and be wiggly, and they may even need to be removed. Periodontal disease affects other parts of your body as well. It could be heart disease, atherosclerosis, diabetes, and pregnancy complications, and it can also affect your cognitive memory like Alzheimer's, as well as respiratory problems. For heart disease, if you have periodontal disease, you are 2 times more likely to develop heart disease. A recent study examined the presence of bacteria known to periodontitis and the thickening around the blood vessel wall, commonly seen in heart disease. The study found that an increased level of blood vessel thickening was associated with the presence of the same bacteria found in dental plaque that's known to cause periodontitis. Patients with certain heart conditions have a higher risk of endocarditis. This is an infection of the heart. It can be life-threatening. It happens when bacteria in the bloodstream attach to the damaged heart valves or other damaged heart tissue. Some drugs that treat high blood pressure can cause dry mouth, also called xerostomia, or an altered sense of taste. Gum overgrowth is also a possible side effect of some drugs that treat high blood pressure. This includes calcium channel blockers and can begin as soon as 1 month after you start the therapy. Research shows that there's an increased prevalence of gum disease among those with diabetes, adding serious gum tissue to the list of other complications associated with diabetes, which is heart disease, stroke, and kidney disease. People with diabetes are more susceptible to serious gum disease, but serious gum disease may have the potential to affect blood glucose control and contribute to the progression of diabetes. People with diabetes are at an increased risk for serious gum disease because they are generally more susceptible to bacterial infection and have a decreased ability to fight bacteria that invade the gums. Gingivitis during pregnancy is a mild form of gum disease that can progress to periodontitis, which can increase the risk of premature birth, low birth weight, or preeclampsia. Proper oral care before, during, and after your pregnancy will help you to prevent these issues and keep your baby as healthy as possible. People suffering from certain respiratory diseases maybe using anti-inflammatory medications, which means that they can experience dry mouth, an increase in plaque and gingivitis development, and be more susceptible to yeast and fungal infections. Because bacteria enters the lungs when you inhale, harmful bacteria can grow and live there. Your immune system can usually prevent bacteria that enters the lungs from causing problems, but the lung tissue can still become irritated and inflamed. The bacteria can also cause bronchitis and pneumonia and make conditions such as emphysema and chronic obstructive pulmonary disease worse. You can prevent periodontal disease from occurring by brushing at least 2 times daily, flossing at least once per day, swishing with mouthwash, and knowing your other risk factors, such as if you smoke, it can cause dry mouth and make the gum tissues appear to be healthy, but even though they're not. Heavy sugar and carb diet feed the bacteria, which then produce acid that breaks down the teeth. And then also to see a dentist at least 1 time per year so they can complete a comprehensive exam. This exam measures bone level, pocket depths, and how much plaque you have, and checks for other risk factors. In conclusion, periodontal disease is caused by bacteria that lives in dental plaque. Your body responds to the bacteria by causing the gums to inflame and eventually damage the bone that can lead to tooth loss. Periodontal disease cannot be reversed, but it can be maintained. Only when you have gingivitis can it be reversed. It can affect your heart, lungs, cause diabetes and pregnancy complications, but with proper oral hygiene and annual dental visits, it can be prevented from progressing or getting worse. Thank you.
I have a question about the pocket depths. Is that from the basically edge of the gum to the where it's sealed, or what exactly is that?
It's measured right underneath the gum. The ruler goes down and it'll measure how deep the pocket is, and how deep the pocket is that can mean that it's worse. I don't know if that answers your question.
Okay.
Any other questions?